All right, good evening, everyone. It's a pleasure to be with you all today. As I mentioned earlier, I'm Dr. Samira Addrey, a graduate of the Latin American School of Medicine, known by its Spanish abbreviation as ELAM, for Escuela Latinoamericana de Medicina. I'm also the program coordinator of the scholarship program that is administered for U.S. citizens by IFCO for ELAM. So I have the pleasure tonight to open our discussion on healthcare and what we can learn from Cuba and our hopes and struggles to have a single payer system or a system that will actually provide healthcare to all in the United States and qualify the belief that we have that health is a human right. Okay. So to begin with, we're going to start with the questions before us. The central question for today's discussion is simple but profound. Is healthcare a human right or is it a commodity? Cuba has chosen one path while the US has taken another. But I want us to consider how Cuba's healthcare model, developed under conditions of scarcity and blockade, can inform our efforts here, especially as many of you in the audience are organizing, whether it's for state health plans or for a national single payer plan. We want plans that are grounded in equity. So is Cuba's healthcare system an example to emulate or a threat to be destroyed, as the flyer for today stated? As we proceed with this conversation, keep this framing in mind. It's not just about what Cuba has accomplished, but also about the lessons we can bring home. So the foundations of Cuba healthcare lie in that there are some basic elements to this whole plan. It's a robust healthcare system, but first, it is provided free of charge. Every Cuban, regardless of their income, can see a doctor, receive lab tests, and access treatment without any bills or insurance paperwork. Second, it is accessible and regionally distributed, so healthcare services are available throughout the entire island, ensuring that even in rural towns, people have access to care just as people in urban centers do. Third, the system is community-centered. Doctors and nurses live in the neighborhoods they serve, actively reaching out to patients instead of waiting for them to come to clinics. They visit homes, schools, and workplaces to provide care and support. And there's a dynamic process in making sure that this health care that is provided is meeting the needs of the people. Finally, this healthcare system is one that prioritizes prevention. The philosophy emphasizes that health is maintained not only in hospitals, but in everyday life. The system invests heavily in screenings, health education, vaccinations, and early intervention, which ultimately reduces the need for costly late-stage care. Then we move on to the structure of the Cuban healthcare system. This is how the system is organized. The Cuban healthcare system has three primary levels: the primary, secondary, and the tertiary level. The structure of the primary level has at its base the family doctor and nurse teams, and each of these teams are responsible for approximately 150 families. They live in a community, they conduct home visits, and monitor health across the lifespan of these families. And those family doctor and nurse teams feed into polyclinics, which are at the community level as well. And they attend to about 30,000 or 40,000 people. And this is where people receive access to, they receive care from specialists. They have access to labs, rehabilitation services. Sometimes there are departments built into these polyclinics that have natural and traditional medicine offered. They have dental care. They also provide maternal, child, and health services within these polyclinics. The polyclinics are also supervise the family doctors and the family nurses. And so that ensures that the programs that are carried out at a community level are coordinated and not isolated. Then the next level, the secondary level, is where you have hospitals, teaching hospitals, such as the ones that I trained at in our clinical years of the Latin American School of Medicine. And these hospitals provide advanced and specialized care where they attend to more complex diseases. A key feature of this system is there's a smooth referral system. The process of referring patients from the community to the hospital is not convoluted, and this ensures that patients are not lost within the system. And while the patients are in these hospitals, it is one of the duties of the family doctors and nurses to track the cases of these patients and make sure that they follow up with them when they return to the community after being discharged. There's also a tertiary level, which has specialized institutes. This is where you get the even more advanced care that is necessary, whether it's an institute of cardiology or neurosurgery or tropical diseases. These are the places where it's also, in addition to research being carried out, there is care provided for the patients who need that extra level of care. And this is all accessible to the everyday citizen of Cuba, again, following the same non-complex referral system that I referred to earlier. More importantly, the Cuban healthcare system is not disjointed from its biotech sector or public health, unlike here. This is integrated within the whole system. So we have pharmaceutical research that is not profit-driven, because Cuba focuses on developing medicines and vaccines that address national and global health needs. And this commitment was notably highlighted during the COVID-19 pandemic. But it's important to highlight this because we have such a different experience with our healthcare system. But these are some of the differences that Cuba shows us. So there are some principles that guide the Cuban healthcare system. And these principles are pretty basic, but very important. It is a continuous process that patients are not supposed to be taken care of just at certain moments of their life, but throughout their lifespan. They're also not disconnected between providers because, as I shared, there's a community grassroots level up kind of flow that guarantees that patients are being taken care of by people who know them well and know them beyond just their individual specific illnesses, but in a context that they have worked and grown in. And this helps the family doctor to follow their patients from childhood to adulthood and coordinate with the different stages of care that are necessary as they move on through the system. There's also the fact that this is a comprehensive healthcare system we're talking about. This is very important because, as you know, as we advance in the world, unfortunately, we also become more specialized in our knowledge. And that has a tendency of sectioning out our illnesses or our health problems by specific systems. And you have to go to 5 different doctors because you have problems in 5 different parts of your body. And that is not comprehensive. Whereas in Cuba, the whole person is at the forefront of care. Whenever we see you, we're tasked to look at you not just as an illness, but as a person with a background, a family, a support system, a job or not. Whatever your story is contributes to who you are and what you are going through. And so this is a task of Cuban medicine to consider the whole person and integrate physically, mentally, and socially the health that is required. So finally, also, no one is left behind. This is a system that really sees health as a right and as a form of social justice. It is where people are not left behind in terms of the most vulnerable. The ones that we should always be looking out for are some of the key priorities of this healthcare system. And no one is limited by their income, or, like I said, there's no such thing as insurance. So your insurance status doesn't prohibit you or give you the privilege of health over somebody else. So this is important that from urban to rural areas, everyone has a right to care. And while these principles seem straightforward, they are radically different from the healthcare experience we have in the US that is often fragmented, profit driven, and sharply unequal. So now we will talk about the achievements under adversity. And I frame it this way because this has been basically the life story of Cuba's healthcare system has been inventing and reinventing itself under very strenuous policy and conditions in their country. Some decades have been easier than others, but it's always been under threat of being destroyed. And this is a situation where we have currently in the year 2025, Cuba has continues to achieve things like a high life expectancy, 78 years old, which is higher than the US life expectancy, which is 76, and the global average is 73. But this has been done despite all the challenges, especially that were posed by the pandemic recently and the shortages that have been happening over decades. There's also an infant and maternal mortality rate that is lower than most of its counterparts in its region. At one point, these rates were lower than the United States, but due to the pandemic, they've gone up. But Cuba continues to struggle to do better. And it is important to highlight this because Cuba has made it a national priority to prevent the deaths of infants and mothers as much as possible. And because they've made it a national priority, it drives a lot of the policies and the day-to-day activities that they carry out are geared towards making sure that this happens less and less. Additionally, Cuba has one of the highest doctor to population ratios globally. Although migration and medical missions abroad have impacted this ratio, the country continues to invest in training to replenish its health workforce and also to replenish the workforce of many, many countries of the global south. Cuba's commitment to health extends beyond its borders. There are over 28,000 Cuban doctors that are currently serving in 58 countries. They've been providing assistance in these countries, primarily due to whether it's epidemics that happen or disasters or sustained efforts throughout the years. And to be frank, it's way more than 28,000 that have served in the over 60 years that Cuba has been sending doctors abroad. It's been 500,000 or more health workers who've been sent abroad in over 160 countries. That is a huge feat for a small island of 11 million people. Well, not 11 million anymore, it's about 10. But this is a reality and it's an achievement, and we cannot underestimate that. Cuba has also achieved universal vaccination programs. This country was one of the first in the world to eliminate polio, measles, and diphtheria through mass vaccination, and has maintained high coverage even under blockade. I'll talk a little bit more about this because this is super important because, again, Cuba has done this under a lot of pressure and producing their own vaccines. Finally, nearly 100% of Cubans are covered by the family doctor and nurse team. Every household is on a registry, and each family is regularly followed, visited, and tracked. This is an accomplishment that most countries, especially the United States, has never achieved. And this is important because in studying there, you get to see how these family registries are updated annually. Medical students, as part of our curriculum, were involved in working with the family doctor and nurse team to help them update that information. So this information is reflective of the changes that are happening in your society from year to year. And it's important because they don't only collect information about what's happening with families and individuals, but they use that information to guide the sort of health programs that they implement at a community and a national level. So, as I was saying, we've seen how Cuba's resilience has produced remarkable results, but some of these achievements have been from the biotech sector, which started in the 80s and was an investment that has truly saved Cuba at the hour that basically they were left to fend for themselves. So this has been innovation under siege. And in that, I just mentioned the COVID-19 pandemic, where Cuba was able to develop 5 vaccines. And these vaccines, Abdallah, Soberano 1, Soberano 2, Soberano Plus, and Mambisa, were all produced while facing barriers to importing syringes, reagents. Purchasing vaccines even on the open market was something that was hard for Cuba. And this led to Cuba becoming the first country in Latin America to vaccinate children as young as 2 years old, thereby protecting even the youngest members of society. And it's crucial to emphasize this point because for a long time, the vaccines we had for COVID could not be administered to children. But I can tell you that from the very first moments that the pandemic hit, the talk of creating a vaccine that was baby safe was what Cubans were talking about, because they had daily reports that were given to society. But not only that, they had their top scientists come and speak to the public about their plans for this vaccine, and the priority being to keep their children safe, because as you know, Cuba is an aging population. They have more elderly folks in the population now and less younger people. And so making sure that children didn't die from COVID-19 was really important for these scientists. And they sought to make the vaccine as safe for children as it was for the elderly, which are 2 very important vulnerable groups in society. So this is something that people don't talk about a lot, but it's important. This success, though, didn't happen overnight because it took all the knowledge and experience that Cuba has accumulated from previous years of developing other vaccines, such as 8 of the 11 that they use for their national vaccination program. Those vaccines are also produced in Cuba. So they were using the same technology and platforms that they've used to produce previous vaccines to help them produce these new ones. And that's important because if they hadn't invested the time and energy in creating for themselves a system of self-reliance, they would not have been able to beat COVID-19 and save their population. The biotech sector in Cuba is unique. It's a unique story and a beautiful story because it is publicly owned. The shareholders are the people of the nation. And biotech research is made to serve health, not for profit. This definitely impacts the sort of projects and medicines that biotech focuses on, as opposed to what we know here, where health is not necessarily at the core of the discussion when it comes to some of these research companies and pharmaceutical companies. So for Cuba, it is different, and it shows us that there are possibilities that definitely put saving humanity at the core, and don't take away from what science can do for us. Cubans have also been pioneers in therapies for diabetic foot ulcers that has saved thousands of patients from amputations. They've developed innovative vaccines for lung cancer. They continue to research Alzheimer's and other neurodegenerative diseases. They've been able to make headway in research against hepatitis B treatments, also producing the first meningitis B vaccine. There are important things that Cuba has contributed to world and global health, and they're not told in enough places. So it's important for us to learn more and see what we can learn from Cuba. So this same philosophy of also producing for themselves and sharing what they have, which they've done with doctors, is the same concept they apply to their medicines as well. They've been able to export a lot of the products that they make in order to help other countries of the global south get access to them at a low cost. This is huge because, as you know, the poorer you are, the harder it is for you to access life-saving treatments. And Cuba is using its science to help bridge that gap. So now we talk about how Cuba has gone beyond its borders in making global health brigades and training medical personnel for the world part of its mission. So Cuba's vision of health solidarity extends beyond simply sending doctors. It involves training physicians around the globe. Cuba has sent doctors to the front lines of Ebola, earthquakes, and COVID-19. And I also can't help to think about the situation in Gaza right now, where instead of doctors and medicine, bombs are being sent. Health cannot exist under siege, under occupation, or under genocide. But Cuba has shown us that we can continue to persist in what we can do for the world. One prime example of, for example, the young Palestinian doctors who are training at the Latin American School of Medicine, which is the medical school I attended, and that has graduated over 30,000 doctors from over 100 countries, 245 of whom are from the US. And this school is one of the examples of how Cuba has made an investment in helping to rebuild the health force of the world. Cuba has also established medical faculties. And for example, in Yemen in 1976, in Guyana in 1984, in Ethiopia in 1984 as well, in Guinea-Bissau in 1986, in Uganda in 88, in Ghana in 1991, in the Gambia in the year 2000, in Equatorial Guinea in 2000, in Haiti in 2001, and Eritrea in 2003. These institutions continue to train local doctors, with Cubans being the faculty, being the teachers of these young people. And that amplifies Cuba's impact and also grows the native population of physicians and health workers for those countries and for those regions, which is a huge thing, and not often talked about either. Another example of this kind of important health solidarity is the Mandela Castro program that has led to thousands of South African youth being trained in Cuba. And then this program helps them to return home and to serve in their public health system. Then you also have the famous Henry Reith Brigade, which was established in 2005. And some of you know the backstory behind that. The initial offer was for about 1,500 physicians to be sent to New Orleans post Hurricane Katrina. And unfortunately, the Bush Jr. administration rejected that offer. And instead of Cuba to dismantle this brigade, they kept it and sent the brigade on to Pakistan because there had been an earthquake that had happened. And then it became a full-fledged mission with different brigades in different countries. And now they're in over 58 countries, working in all places, often rural, remote places where doctors have never been to. And this initiative is neither charity nor profit. It embodies true solidarity. And as Fidel once said, Cuba no da lo que le sobra, Cuba comparte lo que tiene. Cuba does not give what it has left over, Cuba shares what it has. And this is one of the best examples of a global model of solidarity that stands in sharp contrast to the US healthcare system, which spends the most in the world, but leaves millions uninsured and underserved. So a little bit about the US healthcare system. For those of us who are not as aware, unfortunately, the US healthcare system is the most expensive and unequal in the world. The US spends more on healthcare than any other country. It spends about 18% of its gross domestic product on healthcare, but the health outcomes rank among the lowest in the developed world. Life expectancy in the US has dropped to around 76 years, which is lower than that of Cuba and most wealthy nations. This decline worsened due to COVID-19, but it had begun even before the pandemic. We're also facing a severe maternal health crisis. The US has the highest maternal mortality rate of any wealthy country, and Black and Indigenous women being 3 to 4 times more likely to die from pregnancy-related complications. This issue is as much about racial justice as it is about health. At least 100 million Americans are burdened with medical debt, making healthcare costs the leading cause of personal bankruptcy. Many individuals delay seeking care or avoid doctors, not only because services may be unavailable, but because they cannot afford them. The healthcare system is fragmented and profit-driven. Insurance companies often deny claims, patients frequently switch between providers, and care is frequently organized around billing codes, not the needs of individuals or their families. In rural America, we've seen over 100 hospitals closed in the last decade, leaving millions without accessible emergency or maternity care. Meanwhile, safety net hospitals in urban areas are struggling to stay open. And those are public ones, right? Most Americans obtain health insurance through their employment, meaning that losing a job often results in losing healthcare coverage. And during the COVID-19 pandemic, millions found themselves uninsured overnight when businesses shut down. This is part of the weaknesses of our system. Also, unfortunately, Americans pay the highest prescription drug prices in the world. Families are forced to ration insulin, cancer treatments, or asthma inhalers, not because these medications don't exist, but because they are too costly. The system leaves too many people behind, but that is why we're here, continuing to struggle. And it is important for us to remember that there have been moments in the US history where movements for health justice have won real gains, and those victories remind us that change is possible. So that brings me to my next point, which is, in the history of the US, is not as bleak as, it could be. We've had moments where people have fought for our health and they've won. And it's important to fall back on that history, but use it as a launching pad to continue the struggle for a better and a sustainable system. So, for example, in 1965, we established the Medicare and Medicaid programs, expanding access to healthcare for millions. And that also forced hospitals, especially in the South, to desegregate in order to receive federal funds. During the 1960s and 70s, the community health center movement arose from civil rights and anti-poverty struggles in places like Mississippi and the Bronx. And today, these centers, which span up all over the country, serve over 30 million people. And they're deeply underfunded, these community health centers. They need more resources, and we need more of them. In 1972, the federal government established the National Health Service Corps, which places young doctors in underserved rural and urban areas. This initiative recognized that communities in greatest need were often the least served and was achieved through grassroots pressure. And this is a key example for me because, for example, I went to Cuba to study medicine for free, and this program, the National Health Service Corps, is here in the United States, but it's not broad enough. It doesn't cover enough people, and it's not something that we should keep small. It's something that we should expand, because service-oriented repayment would open the door for a lot of people to be able to go into primary care and go into medicine, to be able to reach more and more people. Throughout the 1970s and 80s, Native and Indigenous health activism helped strengthen the Indian Health Service and advance healthcare sovereignty. The disability rights movement made significant strides with the passage of Americans with Disability Act in 1990. That expanded access and healthcare for individuals with disabilities. And at the same time, the HIV/AIDS movement of the 1980s and 90s, led by organizations like ACT UP, revolutionized drug approval processes and compelled public health agencies to prioritize the voices of patients. In 1997, the Children's Health Insurance Program was established, providing coverage to millions of children who would otherwise be uninsured. In 2010, we had the Affordable Care Act that expanded coverage to more than 20 million people and prohibited insurance companies from discriminating against individuals with pre-existing conditions. And then over the last decade, grassroots campaigns have successfully expanded Medicaid through ballot initiatives in conservative states. Meanwhile, groups continue to advocate for bold new efforts, including the abolition of medical debt and state-level single-payer healthcare systems. These milestones illustrate that despite the predominance of corporate profit in the U.S. healthcare system, people's movements have consistently driven towards greater justice in healthcare. And so we must use that to continue to inspire us. So what we can learn from Cuba in all of this. For us, Cuba demonstrates that health justice depends not on wealth, but on political will. That's a huge thing. If our system had a quarter of the political will that Cubans have in order to safeguard healthcare, we would be in a better place. And so Cuba, a country under blockade, chooses to invest in health and solidarity while we spend billions funding wars, including the genocide in Gaza. While millions of people here can't see a doctor. That's not a resource problem. That's a priority problem. And first, in order to rectify the situation, we must invest in equity, because we know the long history of this nation and how many people have been left out of it from the beginning. And equity must be at the core of what we do and fight for. Healthcare should be guaranteed as a right, not a privilege tied to income, insurance, or where we live. Also, we must prioritize prevention and primary care. Similar to Cuba's family doctor model, this approach involves placing healthcare workers within communities to conduct home visits and identify problems early. We should also humanize healthcare and data. I believe this strongly because in Cuba, family doctors and nurses continuously collect and update information about each family. And these are not just medical records, but also how they reflect housing conditions, employment status, school performance, and other social aspects of life that influence health. The US, we should also make medical education free and service-oriented. This I just spoke about in relation to the National Health Service Corps as an example. But just imagine if we had medical school free, and the sort of system where if you went to school for if you went to medical school for free, all you'd have to do is serve maybe 5 years in a community that's underserved. The same mantra that Cuba has, which yes, there are some medical schools that are that have set up scholarships based on the same principle, but it's not enough. Again, it's left to private institutions to decide who and what can access that. But there's no national initiative to do that. And more, it's been shown that doctors who are reflective of their communities are better for their communities. And that's where we need to close the gap. Medicine continues to be for those who have or have access to connections to those who have, and not so much for the poor and marginalized of our society. And in order to make this correction, we need to make medical education free. And we also need to make it service oriented as a value system correction that we need to make as a people. We should also consider adopting the maternal homes model, which protects mothers with high risk pregnancies. This is of particular importance because in Cuba, these maternal homes are providing lodging, free lodging. They're usually near a maternity hospital or polyclinic, and you have clinical monitoring on a daily basis with meals, rest, and stress reduction. You have a multidisciplinary team with an obstetrician, a family doctor, a nurse, a nutritionist, a psychologist, a social worker. You have health education about, prepping the mom before they give birth, teaching them about breastfeeding and its importance, postpartum planning, and support system building. And then there's also continuity, because once you're done with the birthing process, your family doctor or family nurse is also collaborating with this team to make sure that you are having a good postpartum follow-up in the community. And these are ways that the maternal health program in Cuba safeguards the lives of women and infants. And it's important. It reduces delays in care, and it improves birth weight and early complication detection, and has contributed to lower maternal and perinatal mortality over the decades. And I can't stress this enough, because the interventions that this maternal home provides are social determinant interventions, which are just as important as medical care. If you don't have housing, you don't have good nutrition, you don't have rest, you don't have, daily monitoring and education, that is what increases the likelihood of a preterm birth or other complications. And that's a reality in this high stress country that we live in. So that's something we should consider, adopting that model. We should also look to nationalize pharmaceutical and biotech industries. It's a big ask, but we have to dream of the world that we want. We want the medicines to be for the people. We want the vaccines to be for the people, and we want them to be developed by scientists who, at their heart, want to do this kind of work and don't want to be controlled by purse strings, right? So that is what we should do it, and we should nationalize pharma and biotech. We should also push for a single-payer healthcare on a national ballot through a referendum. This is something I learned through Cuba. They put everything on a referendum in that country that is considered. Any law that's going to change officially has to be voted on by all the people. People have to be informed. Workshops have to be given on a community level, explain questions, things are revised over and over again. And the same kind of thing can happen here in the United States. There's not been many things that have been put on a national ballot for a referendum, but this is one of those that is super important for us to do, because the fact of the matter remains that we do not want this decision to be gridlocked in Congress, nor do we want to leave it in the hands of a Supreme Court that no longer protects our rights. And we should be the people to decide that healthcare is a human right. So these are not abstract ideas, they're practical lessons rooted in Cuba's experience, illustrating a path towards health justice here at home. So with that, I just want to end that if we began today's presentation with is Cuba's healthcare system an example to emulate or a threat to be destroyed? Answer for yourself. There's a lot of good that we can learn from Cuba, and we should be proud of that because Cuba is our neighbor, a small country that's doing a lot, and we are a bigger country that needs to do better. When we examine Cuba's foundations, its achievements despite adversity, and its commitment to global solidarity, the answer is clear. We should emulate. And our own history in the US also demonstrates that we can achieve change when people come together and organize. That's where those victories for Medicare, Medicaid, community health centers, all of those prove that health justice is possible when movements mobilize for it. Today, with campaigns all over the country in different states, we face a crucial moment of decision. Will we continue a system where profit takes precedence over life? Or will we demand healthcare as a fundamental human right? Health is a human right in Cuba, in the US, Palestine, Congo, Sudan, and everywhere people are struggling to live with dignity. Our solidarity has to be global because injustice anywhere endangers health everywhere. So Cuba reminds us that another world is possible and it is already being practiced. It is up to us to take up that fight here. Hasta la victoria siempre. Thank you.